Oh, please, yes. There you go. We blast every day in this building. Thank you for joining me, everyone, for what will begin to be regular press briefings, particularly this week. We plan to do this daily over at least the next 4 days in an effort to get information out there. One of the most valuable things that we can do is provide as much information as possible to Tennesseans so that we can work together to help mitigate the spread of this disease. As of today, we have 52 confirmed cases in Tennessee, and we are working hard to disseminate guidance that's up to date and consistent with the COVID-19 epidemic across the country. It's difficult to disseminate guidance that changes rapidly, but we will provide information as soon as we get changes. The CDC is recommending, for example, no more than 50 people in a gathering, and President Trump just announced in the last hour that their guidance is no more than 10 people in a gathering, which we will begin to suggest as well. But information changes that rapidly, and that's the reason we want to continue to provide information as soon as we can. Today, I want to talk primarily about the three things that we know most about right now that most affect Tennesseans, and that is schools and school closures, testing, and then the future of our efforts with regard to our budget and our updated budget and the legislative process. This morning, we announced a decision to urge all counties to close schools over the next several days as works with their schedule. The number one driver in that decision was the safety of our children and of Tennesseans. The increased awareness that social contact with people in close proximity to one another has driven that decision to close schools. We also know that, and we'll be closing those schools till March 31st, and then we will assess where we are at that point and make further, and give further guidance to the schools. We know that closing a school has a significant impact on families all across Tennessee. It's very important that we work very hard now that we've made this decision to have schools closed, that we work to minimize the amount of impact that has on families. To that end, we are working directly with the federal government, and our Department of Education is working directly with the federal government to make sure that we receive waivers, and we have given assurances that we'll have those waivers that allow our low-income students to continue to receive meals as they would be if they were going to school. So we want to assure families that when a school closes, if their children qualified for lunch in that school, then they will continue to receive those lunches. And we will be distributing those lunches to those families in, it's undefined yet exactly how that will happen. Some districts are already doing it and providing a model for that, but we will provide food for students when their schools close. And then other changes that occur as a result of school closures we'll be looking at in the days ahead. The most important thing was to get the schools closed and to make sure the students were fed, and then we'll begin to look at next steps regarding all that needs to be done because of closing schools. And let me just say one thing here about school closures and about the need for Tennesseans to engage in their communities. We saw over the last several weeks how Tennesseans came together to help their neighbors when a tornado came. What's about to happen across schools, across this state, is that schools will close. Students who have no child care will be returning home. Parents who have jobs that will require them to be out of the home will be facing dilemmas, and hardships for families will immediately take place when schools close. I'm urging Tennesseans to step up in their communities and to be a part of the solution. Yes, we will pursue funding, we will pursue relief. It's a part of what we're doing in adjusting our budget. But what we really need are Tennesseans to step up and engage. If you're a church, you need to consider adopting a school. If you're a family that has an opportunity to keep a kid for a neighbor whose parents both work, you ought to consider helping that family through the time of transition. Tennesseans can do this. This is what we're made for. And I encourage Tennesseans to take this example to serve their neighbors, as well as many other examples that will be presented in the weeks and months ahead as we deal with this crisis across our state. As we assess the major public health implications of COVID-19, I am very encouraged about the access to testing that has become available in our state. We have worked very hard in the last couple of weeks to pursue the increase of available testing for Tennesseans. The more folks can get tested, the more likely it is that we will slow the spread of this disease. We have worked with the private sector through and with our public health department to increase the amount of testing available and the sites with which people can be tested. So there's a lot of talk about drive-through testing, and that looks different in different locations, but what we're really talking about is remote testing that provides access for people who otherwise would have to go into a hospital or a health facility to be tested. I'm pleased to announce today that we have currently planned 15 remote assessment sites that will be up and operating across our 6 major metropolitan areas by the end of the week. Some of those sites are already open. I was on a call with the White House and other governors today, and it's our understanding that millions of available tests will be distributed throughout the country over the next week or 2 weeks. Beginning today and ramping up over the next 2 weeks. We currently have the capacity to test thousands a day in Tennessee now, so we have sufficient tests for the people that are presenting themselves to be tested. And now we are delivering and we are bringing online remote testing sites from one end of the state to the other. While testing capacity has expanded, however, and while we know that we have sufficient testing to meet the needs of the folks that present today, I want to call on the healthcare community broadly to be a part of this effort that we believe is so important to get people tested across Tennessee. The healthcare community must be vigilant about assessing patients who need it. And I urge physicians, I urge urgent care clinics, I urge every rural hospital and every urban hospital, every provider of health care to not turn away any patient who presents themselves with a willingness to be tested, to be assessed to determine if they need a test. We do not want anyone in this state who has a need to be tested and who qualifies for testing to be turned away for any reason. And I want to say to anyone in this state, there is a public health clinic in every county in Tennessee. And that public health clinic will provide guidance and or testing for you if you go to that clinic as a result of symptoms or contact with someone who has tested positive. Now, it's important to say that everyone in Tennessee doesn't need to get a test. And we don't need to go flood the system if we do not have any reason to really legitimately believe that we have symptoms or that we have been in close contact with someone who does have the virus. But if those things are true, you should, number one, call your healthcare provider, call your doctor, let your doctor advise you on the quickest way to get that test done. Call the local clinic in your area or call the public health department in your county, and you will get a test. And let me say this as well. Let every Tennessean know that we don't want anything to hinder them from access to testing. If you are uninsured, you can present at any public health facility in the state of Tennessee, in any county, and you'll receive COVID-19 testing at no cost if you qualify for testing. So we don't want there to be any reason that people who need to be tested do not get tested, or that there is a bottleneck that keeps them from being tested. This will be important for the healthcare community to remember. It'll be important for Tennesseans to remember, and we're going to work hard to make sure that if people believe they need to be tested, they will be. I want to shift from mitigation efforts before I let Dr. Piercy speak, and then of course we'll have questions. But I want to address the announcement that was made earlier that the legislature will be acting on our accelerated budget presentation. So we have an obligation to pass a balanced budget. In fact, in part, in order for us to have the funds necessary to provide relief for those who will need it most over the next few months. To that end, our administration will present a budget in the next 2 days. We are working around the clock right now to adjust the budget that we presented earlier in the year. We certainly know that the economic conditions have changed dramatically in the last few days. Forecasts for growth, forecasts for the future economy of our country have changed dramatically. And therefore, we have a responsibility to adjust as well in state government. So we are making those adjustments. We are assessing those forecasts, and we will be presenting an updated budget in the next couple of days. The goal is to have that done by Wednesday so the legislature can review that budget and pass a balanced budget according to our state constitution. That will be important, as I said earlier, to provide not only for funding state government, but for funding the relief efforts that we see that will be coming in the future. We are encouraged about the efforts that we have made and about the progress that's being made and about our partnership with the private sector providers that are providing remote testing. We're encouraged by the way Tennesseans are coming together to address this challenge, but we have much before us. And we will be talking about all that is before us on a regular basis. As I said, we'll have briefings every day for at least the next 4 days, and then into the future. I want Dr. Piercy to make a few comments as the head of our Department of Health, and then we'll open it up in a few minutes for further questions. Dr. Piercy.
Thank you, Governor Lee. I appreciate the information about testing, and I wanted to add a little more detail to that. As you have heard already, the more tests we have, the more positives we will get. Don't let that alarm you. Just know that that's coming. We have just put out our numbers for today. Our numbers for today are 52, and you will notice that the majority of those are still in urban areas, Davidson and Williamson. That does not mean that the rural parts and other urban parts of our state can slack off in any manner in social distancing. I do want to applaud both Metro Nashville as well as the health systems in Nashville for the swift and thorough response they have had over the last few days as this case count has grown in these areas. You will also see on our website that starting just a few minutes ago, we are now reporting cases by age range. We are doing that in segments to identify trends that might be in certain age groups. You will also notice that those numbers don't add up yet, and we are posting the ones that we have age data on. So as soon as we get that information, we will update the website. We currently have not seen any specific trends, but we are monitoring for those in every aspect. Finally, I wanted to drive home the point about anyone who needs the test can get the test. But who needs the test? Symptoms are fever, cough, and shortness of breath, or if you're feeling ill and have been directly exposed to someone with COVID-19, you are the ones who qualify for the test. We want to prioritize our test for our healthcare workers and our older Tennesseans, 65 and older. So I want to set that expectation that if you have sniffles or mild symptoms and you go for testing, you might not meet the screening criteria. That doesn't mean that we have a shortage of them. It means we are using those judiciously so we can test the people who need it. Thank you for what you're doing. Thank you for the coverage that you're providing to this ever-changing experience, and we're happy to take questions.
Well, we've actually been pursuing ventilators ourselves. We're going to pursue every effort, and we have we've set up a place in our office to be in constant communication with the federal government for any funding, any relief that they provide, and that changes daily. So we're accessing that constantly, but we started weeks ago planning for this coming to our state, recognizing that there may be shortages, there may be difficulties, there may be a need to pursue equipment like ventilators, and we've actually worked together with our private providers. Dr. Long, who represents the Tennessee Hospital Association, is on our task force, but she also has been meeting regularly with us about how it is that individual hospitals can pursue equipment. We've also tasked our Tennessee Emergency Management Agency, TEMA, with pursuing personal protective equipment and masks and all the types of equipment that will be necessary to do more testing and to provide adequate care for those who may contract the disease. TEMA is working with us for procurement of that as well. So there's a number of agencies and organizations that we began working together to procure that which is needed. Yes, sir, Andy. So remote testing facilities are looking a lot of different ways. Some of them will be very temporary testing facilities, tents in a parking lot that are equipped to appropriately provide safety, public safety, and provide testing at the same time. However, many of our private providers are actually employing facilities, brick and mortar facilities, a walk-in space that may be an existing facility that they've procured for this use, but it will be dedicated entirely to COVID-19 testing, and anywhere in between. But the point is that there will be remote specifically designated for testing and equipped as such, either from the Department of Health or from private providers. And yes, we have talked with the National Guard and are having our conversation, our National Guard have conversations with those private providers to provide assistance if necessary. We also have medical personnel within the National Guard that we want to utilize as these testing centers ramp up.
I have two questions for you. The first one, going back to education, the Tennessee Education Association is calling for the administration to cancel all Tennessee-ready testing. They don't believe the teachers or the parents are going to be, the teachers or the students are going to be ready. Thoughts about that? I mean, is that something you're considering at this point?
Well, what I said earlier was today we announced closures because that's the most urgent need. And we announced our strategy for food distribution because that is an immediate and urgent need. But there are a number of things that will have to be addressed. Testing, assessments, minimum day requirements. There are funding associated with numbers of days that schools are in session and the varying numbers that multiple districts will have based on who closed when. So those are all very important issues that will have to be addressed, and we are actually in the process on every one of those, but we don't have finality to those yet, but we will in the days ahead.
My second question, it's about your statement this morning. You were encouraging schools to close, but you're not mandating them to close. I wonder, why are you choosing to encourage them and doing it as a suggestion and not as an executive order or a mandate?
Yeah, you know, every school district is different. It's why some had closed earlier than others. There are varying circumstances in industries, school districts, counties, regions, and statewide mandates are not as effective as encouraging behavior. I mean, Tennesseans are going to have to come together to make this happen. They're not going to come together because we force behavior in every household, right? This is something that we need the public to weigh into and to come alongside our guidance and our suggestions. We believe that every school district will close as a result of that suggestion, and we believe that in the spirit of bringing people together to actually have more involvement, we'll do that through encouragement and through admonition and through strong suggestions. Yes, sir.
Your counterparts in other states have done some significant measures, including calling for bars and restaurants to close. Are you considering something like that? And what do you think of Mayor Cooper's announcement?
Well, I think that when we're facing and when we're looking at science that shows that we should try not to gather in spaces of 10 or more, then a crowded bar certainly is not a good idea. It should not be something that people pursue. Tennesseans don't need to be going to bars that are filled with people and that put folks in close proximity. And so I would suggest the very same thing to any environment that is going to put people in close proximity that's not crucial.
And then quick follow-up, does the state have any projections whether how many people might be, tested positive or infected by this, and have there been any fatalities that we know of?
Dr. Piercy, or either, yes. Do either of you have information, ways to answer that question? I don't have that data, so if you do.
Yeah, my name is Dr. John Dunn, the state epidemiologist. We are working with different colleagues to look at modeling. There's some information that's about out there currently. Some of the best information we have, of course, is from the data from other countries and from jurisdictions in our country that are ahead of us.
And what's that indicating right now?
Well, I said we're working on that. We don't have any firm numbers.
Do you have any fatalities in the state? Have any fatalities?
No.
Governor, to follow up on that, if a bar doesn't want to close, though, how do you enforce that? Does the state have to do that in local jurisdictions?
Well, the mayor's obviously the jurisdiction with which the public health officials made a edict to close those bars requires Metro to enforce those. But certainly, we hope that as this unfolds, there won't be a need for enforcement of Tennesseans to comply with keeping people in our state from dying. This is not something that people should be deciding their behavior based on whether or not they're concerned about contracting the disease themselves. Every person that contracts this disease, whether they're concerned about it for their own personal health, they are risking the lives of other people. And that's the message that we want to remind people. You may not have as much personal concern as others about contracting this disease, but people go with the disease undetected for days, making contact with dozens, potentially dozens of people, many of who could be elderly, or making contact with someone who will be in contact with the elderly. We have vulnerable populations whose lives are truly at risk if our behavior in this state is not responsible. And so we implore folks to take responsible actions.
One more. So maybe we're not on this, part of the spectrum yet, but for Tennesseans that might even lose their job or they won't get to work because something's closed or whatever, what can the state do, and are we at the point where you are considering the need to do so?
Well, certainly the state has, for example, unemployment benefits that we will look at to make certain that the reserves are appropriate to provide unemployment insurance for those who qualify for that. We will be announcing, once we clarify what those are, we will be announcing specifics around requirements with regard to TANF funds, for example, needy assistance for needy families. We're looking to loosen the restrictions around those requirements so that folks have more readily accessible, that have more ready access to those funds potentially. None of those are all things we're working on. We're not prepared to announce those yet, but we recognize it's going to come as a great financial hardship to many people, and we want to develop opportunities to help provide relief for Tennesseans of all sorts, not just medical, but also financial. And recognizing, of course, there's a limit to what the government can do. It's one of the reasons that we call upon Tennesseans to assist their neighbors where they can. It'll require effort for all of us.
Governor, how long do you feel like, once the legislature recesses, how long will they be out? And will they be declaring sine die or just taking a break?
Yeah, those are questions that the legislature, the General Assembly will decide, and their speakers. Our role in that is to provide a budget so that they can then make decisions about how quickly they can act on that budget and what the subsequent subsequent meeting looks like. Yes, ma'am. But we don't know how many days. Let me yeah. There hasn't been guidance around that. We'll pursue guidance on that. We're working to look at how we can provide funding for daycare as there's more of a requirement for that as schools close. That will take some time, of course, and there is a significant federal funding package that we've all heard about that has to make its way through Congress in order for that spending and those funds to be available to states. We believe there will be significant relief from federal government, anywhere from TennCare dollars to TANF dollars, but it's not clear what those numbers will look like, but we're staying in constant contact, make sure we know what those are. You want to?
At this point, we're going to open it up to folks on the phone. If I could remind you to please state your name and your outlet before asking your question, and then as well for our speakers to restate the question before answering. All right, seeing none on the phone, we'll have the room for a couple more
Yeah, that's fine. How about some who haven't asked yet? Yes.
You're talking about relief like unemployment. There are a lot of positions, especially in Nashville, whose tours have been canceled, bartenders' wages is going up tips. Can you give them any way that they might be able to make up lost income?
Well, again, the implications of this financial halt we're just starting to see. And there will be a lot of folks that find themselves in difficult situations. We will expand our opportunity for serving those who are in need, whether it's the uninsured, and we are looking at strengthening our budget to provide safety care funding for the uninsured. We don't know, that's one of the things we're considering, funding for TennCare, funding for testing for everyone that is uninsured, strengthening our unemployment benefit, unemployment insurance benefit. There are a number of ways that we can provide safety nets for people, but this economic downturn that has hit immediately and hard will have strong ramifications for many people. We recognize that, and we hope that this will be short-lived. And let me just say this. This is one of the reasons that we have to work so hard to slow the spread of this disease. Because if we can arrest this, or certainly mitigate it to a degree that it doesn't have an overburdening effect on our healthcare system, if we can address this in a meaningful way, we soften the financial blow to the economy of this country. It's why it matters that people wash their hands and stay home if they're sick and don't go out if they don't have to, and don't go to a bar, a crowded bar, and do all of those things that everyone is reminding us to do. It's why this is so important, because people's lives and livelihoods will be profoundly impacted based on how every single Tennessean responds to this. Sam, you started to ask.
Curious, Dr. Pearson, you know if the hospitals, we have enough beds across the state to handle the potential number of patients, and do you have any idea where these testing sites will be in Memphis?
So to answer your first question, we have a system in the state called HRTS, HRTS, Health Resource Tracking System, and that's been something that's been stood up for quite some time, several years. And so we know exactly where our beds are, what our bed capacity is, including ICUs and including ventilators. At this point, we don't have any shortage, but as Dr. Dunn has said, we don't know what the rates will be, and that's the entire point, as the governor just mentioned, about flattening the curve. That line, when you see the chart on flattening the curve, that horizontal line is the threshold of where our health system anywhere can tolerate the influx. And so by spreading out and slowing down number of new cases, our health system is able to keep up better. As far as Memphis, I'm not privy to the exact location yet.
Boy, we'll take last question.
Last week you talked about how the state was going to use those $10 million from the CDC to use them to telemedicine. I'm wondering if you can explain, the status of that telemedicine project right now. And last week you guys said it was ready. When are you ready?
Yes, thank you. We are awaiting continued guidance from the from our federal partners about that $10 million that's coming through the CDC. That will also be supplemented by the $8.3 billion package that's currently being considered and ultimately approved. So telehealth is a really important component of that, because not only does that increase access, but it keeps people in their homes and away from others during this very crucial time. So as has been mentioned, we've got lots of things coming at us right now, but that one is certainly high on our priority list. We would like to have something by the first of the week.
Just one final question. I'm clear on the remote site, 50 across the state, they will be up when?
Well, do you want to address some are up on that?
If I'm remembering correctly, I know we have 11 operational today. and then plans in the next 3 to 5 days to stand up more. And then even beyond that 15, we've got partners working on those as needed. You know, as you can imagine, we don't want to deploy resources before we need them, but we want to make access points available.
And this, they will take, each remote site is going to be a little different from the number of people they can test, but I presume they're going to be in population centers across Tennessee.
Yes, sir, that's why most of them are in the metro areas right now. That does not mean that we don't need them in the rural areas, but right now that's where the population is, and that's statistically where we're most likely to find cases. We're also talking with our EMA partners about how to address testing in rural areas if and when that becomes an issue.
Thank you, everyone.
Let me just make a closing remark. Thank you for being here today. We will do this every day. We want information to flow as rapidly as possible, and we believe that the more Tennesseans are reminded of their individual role, the more likely it is that we can slow the spread of this disease. People's lives are depending on it, and their livelihoods are depending on it, and I believe Tennesseans can do that. I encourage Tennesseans as well. Pray for our state, pray for its citizenry, that we will have wisdom and discernment in the days ahead to make the decisions that will save people's lives and that will mitigate the spread of this disease in our state. Thank you very much. We will talk again to you tomorrow.